Hi, I'm Dr. Blanche Grube, and today I'd like to talk to you about ways of preventing dental decay and ways of eliminating dental decay. There's a lot of talk out in the alternative world about diets that will make cavities go away and ways of making cavities go away without having the necessity of drilling by a dentist and filling by a dentist. I've listened to all of these, I've read the books, I've looked at them, and I have to honestly say, I have not seen one single case of somebody having a true dental cavity, meaning the decay is not only past the enamel but into the dentin of the tooth. That's the definition of a true dental cavity. Weston Price, back in the 1930s, said that if decay was halfway the distance from the enamel to the pulp, halfway, that's pretty much right where the dentin is. He said that if decay was halfway from the enamel to the pulp, that pulp was already infected. And I think he's absolutely right. It's a very, very low-grade infection. It's a matter of the body being able to maintain health by destroying the bacteria a little bit at a time. At the same time, the bacteria are multiplying. So it's this kind of thing. The body is eating up some of the bacteria, but then some of the bacteria are multiplying. So the body tries to maintain a safe level so that the tooth is not hurting you. But eventually, teeth that have large cavities, if the patient was to live long enough, eventually the tooth would die. We don't live anywhere near as long as we were supposed to. So, fortunately, many of us go to the grave with a lot of our teeth, even teeth that have had large fillings. So let's get back to the definition of a cavity. A cavity starts with the demineralization of the enamel. Enamel is made up of minerals and proteins. So a cavity starts with a demineralization of the enamel. As the bacteria in that area of demineralization begin to walk closer to the pulp, then you begin to see a darkness on an x-ray that says you have a true cavity. Some people, they're so sensitive that the moment the demineralization touches the dentin area, they feel sensitivity. They have sensitivity to cold. They have sensitivity to sweet. They have sensitivity if they put a fork in their mouth and they hit the tooth just the right way, or they touch the tooth with the finger. They immediately know there's something wrong there. And that's probably a sign of health. People who have extremely sensitive teeth are probably more healthy than those who do not have sensitive teeth. So, a cavity is when it is not just demineralization, but it has entered into the dentin of the tooth. That is a true cavity. Now, supposedly, if you have a clean diet, and if you put certain solutions like hydrogen peroxide and all these fluoride solutions, you can get the decay to stop heading towards the pulp of the tooth. I'm not so sure that happens. I've never actually seen it. I've never seen a slide, a histological slide. That's where you look at stuff at a microscopic level. I have never seen a histological slide that shows tooth decay, solution put in the mouth, and then suddenly this tooth decay stops and the bacteria disappear. Never seen it. Now, what I have seen is slides where they show if you put a solution of fluoride in the person's mouth, the tooth decay does stop. It continues advancing, but you only see it on a radiographic level. In other words, you see it on an x-ray. You still see the darkness on the x-ray. When the enamel has lost its mineralization, more X-radiation will go through the tooth and land on the film. Therefore, it shows up as a dark area on the x-ray. That's how dentists can tell if you have a cavity. We know where it's well mineralized and where it's not supposed to be well mineralized. And if you have one of those in-between areas where it's dark and it's not supposed to be dark there, we call it a cavity. Well, the company that makes this new solution that will stop decay then gives you a second solution that is supposed to remineralize the tooth. Well, I thought this was wonderful. We actually have a solution to eliminate decay, kill the bacteria. We have a second solution that is going to remineralize the tooth. At the end of the course, they told the dentists that were sitting in the class that if you took an x-ray a few months later, you would still see the darkness on the radiograph or the x-ray. I had a problem with that. If in fact the tooth remineralizes, then should we not have less radiation going through that tooth? And should it not show up dark again or light again on an x-ray? I think it should be light again. If that doesn't happen, well, then that tooth did not remineralize. So I walked out of that class a little disappointed. Once again, I think I've been sold a bill of goods. I think you as the patients and the consumers have been sold a bill of goods. I don't think you can kill bacteria inside a tooth, remineralize it, and have it be restored to being a natural tooth again. You have got to have an understanding of the human body and what makes life and what's not life. You cannot destroy life in the human body, and particularly in the teeth, and grow new life. We haven't figured out how to do that, short of the stem cell research that's being done now, which, again, I'm excited. I'm waiting to see what's going to happen. If they can take stem cells, extract them from your arm, inject them into your mouth, and grow a new tooth, that will be wonderful. That will be a miracle. If you can actually grow a new body part out of the person's own body, it would not only be healthy, but it would be natural, and that would be a great thing. I have not seen it yet. Stay tuned, keep informed, keep watching my videos, because believe me, the day I see somebody cure decay because they have put a solution in their mouth or they have changed their diet, cured decay, I will let you know. I will be the first person to let you know. I have not seen that yet. Thank you. This is Dr. Blanche Grube. Keep watching.